I'm a board-certified medical dermatologist and a Botox Cosmetic National Education faculty member. My medical practice is in Los Angeles, California, where I have successfully performed over 4,000 treatments with Botox Cosmetic since its approval in 2002. Botox Cosmetic is a simple, in-office procedure that can be administered in about 10 to 20 minutes. A visible improvement in the reduction of frown lines can be seen within days, and the results can last up to 4 months. Come with me and I'll show you how to reconstitute the product. I found you can give your patients results that can last up to 4 months by reconstituting and administering Botox Cosmetic at the recommended dilution ratio. That's 4 units per 0.1 milliliter at each of the 5 injection sites, for a total dose of 20 units per 0.5 milliliter. Reconstitution is completed in 5 easy steps. Let me show you. The first step is to use a 21 gauge 2-inch needle and an appropriate sized syringe to draw up 2.5 milliliters of 0.9% sterile, non-preserved saline. Number 2. Insert the needle at a 45-degree angle and slowly inject the saline into the Botox Cosmetic vial. A vacuum is present in the vial, which means that the sterility of the vial is intact. Discard the vial if there is no vacuum. Number 3. Release the vacuum by disconnecting the syringe from the needle and allowing air to flow into the vial and neutralize the pressure. Then, gently mix Botox Cosmetic with the saline by rotating the vial. Be careful during this step to not completely invert the vial. Also, be sure to record the date and time of reconstitution in the space on the label. Number 4. Attach a new sterile syringe and draw at least 0.5 milliliters of the properly reconstituted Botox Cosmetic fluid into the syringe by inserting the needle into the bottom corner of the vial for full extraction. Again, do not completely invert the vial. Expel any air bubbles you see in the syringe barrel. Finally, remove this syringe and attach a 30 gauge needle for administration. Keep in mind, because Botox Cosmetic is unpreserved, it must be used within 4 hours once reconstituted. If you're not injecting immediately, store Botox Cosmetic in a refrigerator at 2 to 8 degrees Celsius. We know that glabellar facial lines, the area between your eyebrows here, arise from the activity of the corrugator and orbicularis oculi muscles. These are the muscles that draw the eyebrows together in frown lines, wrinkle the brow, and are involved in squinting. When you frown, these muscles move the brow medially, and the procerus and depressor supercilii pull the brow inferiorly. This creates a frown or furrowed brow. Are you ready to begin, Jennifer?
Yes.
Good. Some patients may experience minimal and brief discomfort. The sensation is compared to a bug bite. We'll start by placing this cold pack on your forehead to numb the area. For many patients, a cold pack applied a couple minutes before injection provides a sufficient numbing effect. More sensitive patients may require a topical anesthetic. The location, size, and use of the muscles vary markedly among individuals. Lines induced by facial expression occur perpendicular to the direction of action of contracting facial muscles. An effective dose for facial lines is determined by gross observation of the patient's ability to activate the superficial muscles injected. In order to reduce the complication of ptosis, especially blepharoptosis, the following steps should be taken. Avoid injection near the levator palpebrae superioris, particularly in patients with larger brow depressor complexes. Medial corrugator injections should be placed at least 1 centimeter above the bony supraorbital ridge. Ensure the injected volume and dose is accurate and, when feasible, kept to a minimum. Do not inject product closer than 1 centimeter above the central eyebrow. Using a 30 gauge needle, inject a dose of 0.1 milliliter into each of 5 sites, 2 in each corrugator muscle and 1 in the procerus muscle for a total dose of 20 units. How are you doing, Jennifer?
I'm good.
You okay?
I'm good, thank you.
How was that?
Fine, thank you.
Now that wasn't too bad, was it?
Not at all. Dr. Wu, when will I start to see results?
You should start to see results in 1 to 2 days, with the difference becoming very apparent by the end of the week.
And how long can I expect the results to last?
Well, it varies by patient, but generally results can last up to 4 months.
Thank you, Dr. Wu.
Thank you, Jennifer, and we'll see you at your next visit. More detailed clinical trial results are available for your review in the full prescribing information that was provided with this DVD. Patients should be monitored closely following treatment, and repeat injections should only be administered once the clinical effects of the previous injection have diminished. Do not exceed the recommended dosage and frequency of administration of Botox Cosmetic. I would also like to introduce the following items that may lead to better practice management. Patients should be told before they leave the office that they will require repeat treatments to maintain their results. Phone calls and reminders in the mail are 2 effective ways to do this. Another way to reinforce and remind patients is through a practice newsletter. Set monthly or bi-monthly, you can use this platform to discuss trends, treatments, and products relative to your practice. Be sure everyone in your staff, especially those answering the phone, are well-versed in dealing with frequently asked questions about Botox Cosmetic. This can be done with a simple approved script or fact sheet. Also included in your new injector training kit is the dilution wall chart. It provides a simple and quick reference guide for diluting, reconstituting, and administering Botox Cosmetic. Next is the treatment record pad. It helps you track patients' previous injections and treatment history. Thank you for taking the time to view this DVD. I've personally found that following these steps ensures successful outcomes and high patient satisfaction.
If you have more questions after watching this DVD, please review the full prescribing information or contact your Allergan representative. Botox Cosmetic is contraindicated in the presence of infection at the proposed injection sites. Patients with neurological disorders such as ALS, myasthenia gravis, or Lambert-Eaton syndrome may be at increased risk of serious side effects. Serious and/or immediate allergic responses have been rarely reported. These reactions include severe shock, hives, fluid buildup in soft tissues, and shortness of breath. If such a reaction occurs, further Botox Cosmetic injection should be discontinued and appropriate medical therapy immediately started. The most common side effects include headache, respiratory infection, flu syndrome, blepharoptosis, and nausea. The less frequently reported adverse events occurring in less than 3% of patients were pain in the face, erythema at the injection site, and muscle weakness. Please refer to accompanying full prescribing information for additional information. Note: you may wish to push pause on your DVD player now to read this information. Full prescribing information is available as an Adobe PDF file when viewing this DVD on a computer with a DVD drive. If you don't have Adobe Acrobat Reader software, you can obtain it by going to www.adobe.com. To access this file, simply exit the video player mode that you are currently in, double-click your computer's icon for your DVD drive, double-click on the folder labeled Full Prescribing Information, then double-click on the file Botox Cosmetic Full PI.pdf. You can then view and/or print the PDF file of the full prescribing information. 1-800-44-BOTOX